Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. In this OSC original podcast, we look at the latest news in musculoskeletal and pain medicine. Multiple news outlets recently ran a headline that a common pain reliever called pregabalin increases risk of heart failure. This came on the heels of another headline that a cousin of pregabalin, called gabapentin, was associated with an increased risk of dementia. These non-opioid medications are very commonly prescribed, and I have a ton of patients who have taken these medications for years. As you can imagine, this kind of headline results in a lot of messages from patients asking what they should do. Well, let's dig into the study. So let's start with a little background. We've all heard about the opiate epidemic. Opiates spell out of favor for chronic pain for several reasons. Most attention has been placed on addiction risk. Addiction is awful, it ruins lives, and I'm not dismissing it or downplaying it. But the concept that most patients who take opioids become instantly hooked and unable to stop doesn't really fit with the reality of what doctors have been seeing for decades. For me, opiates aren't first line typically for two reasons. The first is that they just aren't universally effective. While they can work well for some, a very large portion of patients will still complain of very severe, functionally limiting pain despite using opiates. Tolerance develops, and these medications do become less effective with time in many patients. The second, and I think probably the biggest reason to avoid opiates, is that the side effects can be really severe. Opiates have a ton of side effects, and as we age, we become more susceptible to those, including sedation and constipation. Polypharmacy is a big deal, particularly in older adults. Opiates don't mix well with a lot of medications, particularly those like benzodiazepines or sleep aids. I'm still amazed at how many of my older patients take a sleeping pill or a benzodiazepine like Xanax every day. These drugs don't mix well with opiates, increasing risk of overdose and death. And in patients who have cardiovascular or pulmonary disease, opiates can be really risky. So what other medications do we have to treat chronic pain? Well, NSAIDs are highly effective for inflammation and arthritis pain, but they have their own set of problems. NSAIDs like ibuprofen are associated with kidney damage, gastrointestinal bleeding, and an increased risk of heart attack and stroke. They have blood thinning effects, so they aren't typically used chronically in patients who take blood thinners. Muscle relaxers have some applications, but certainly they aren't going to help a lot with neuropathy pain or arthritis pain. And their side effects really limit use too, particularly in older adults. In fact, most of them are on a list called the Beers Criteria List that says that they may be or are unsafe for people over 65 years old. So what do we do with this chronic pain problem in America? Doctors and patients were told, NSAIDs are going to kill your kidneys. Tylenol is going to kill your liver, and opiates will make you an addict. So admittedly, that all sounds really terrible. So doctors and patients look to gabapentinoids, like gabapentin and pregabalin for pain relief. These medicines work by binding to calcium channels. Pregabalin binds more to a very specific calcium channel than gabapentin does. These receptors are throughout the body, so the medication impacts the heart and arteries, not just the nervous system. The higher affinity binding of pregabalin explains why it does have more risk of cardiovascular adverse effects, particularly heart failure and peripheral edema or swelling. So let's first note that none of this is really new information. Peripheral edema is a known side effect with pregabalin. We routinely warn patients about this when starting this medication. And while some people may notice the swelling with a low dose, I typically see the edema develop as a patient increases the dose. In patients who have edema already, particularly for those with known heart failure, this is a risk we really have to look for, and if it happens, we have to address it. The American Heart Association has pregabalin listed as one of the medications that can exacerbate heart failure. So again, this really wasn't new information. Now, in this recent study published in the Journal of the American Medical Association Open Network, the authors looked at adults over 65 with cardiovascular disease and compared heart risk failure risk with gabapentin and pregabalin. This, just like the study we previously discussed on gabapentin, is a database study, okay? So this study, however, also controlled for 231 covariates and used something called target trial emulation, where they use statistical analysis to take database information and mimic the design of a randomized clinical trial. So this study we're talking about, pregabalin, is higher quality than the one we previously talked about with gabapentin. They included people with a diagnosis of non-cancer pain who filled a new prescription for gabapentin or pregabalin. They excluded people on the medication chronically and also excluded people with known heart failure or for those with severe illnesses like kidney failure. The primary outcome was hospitalization or an emergency room visit for a primary diagnosis of heart failure. After over 100,000 person-years of follow-up, 1,470 or 1.3% had new heart failure. The heart failure incidence was 18 per 1,000 among pregabalin users and 12 per 1,000 person-years in gabapentin users. Pregabalin was associated with an increased risk for heart failure compared with gabapentin in patients with a history of cardiovascular disease, patients who are white, and patients who are women. While both medications have been tied to cardiovascular adverse effects, the present report extends older, smaller studies showing that increased heart failure risk with pregabalin is more significant. With this type of study, there are definitely limitations, okay? We don't know from this study a few important things. First, do different doses have different risk? We would assume that a higher dose would be more likely to cause side effects, but we honestly don't know that for sure from this data. Additionally, we don't have clear information about the timing of heart failure in relation to starting the medication. So, is this something that happens acutely when starting the medicine, or does it develop more slowly over time? So what does that mean for the 30% of adults over 65 living with chronic pain? First, you and your doctor should have a conversation about your cardiovascular risk when you start these medications. You should know what to look for, and if those symptoms develop, you need to get checked out. If you are taking gabapentinoids and not seeing much relief, then the risk isn't worth the benefit. If you're getting excellent pain relief and not having these side effects, then your doctor will likely continue and just monitor you. All medications have risk. Careful consideration of risk and benefits is warranted. I don't see these medications being less popular anytime soon, but patients and doctors need to be careful about the cardiovascular risk. When it comes to pain management, there is not one medication that works for everyone, and there are no medications that don't have risk. It's complex, which is why it's its own specialty and why, my friends, I have a job. This study highlights to me that the pharmacological management of pain is really flawed, and advances in interventional management, like neuromodulation, are integral to older adults' pain management. Thank you so much for listening. I hope you learned something. Please like this podcast, subscribe. If you have a question that you'd like us to address, let us know in the comments. Until next time, wishing you good health and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.